The roles and responsibilities of healthcare professionals, Unit 10, Aimee Bourne. So this presentation will discuss the recent changes to the roles and responsibilities of the nursing profession through role expansion, the impact that these changes have had on nursing, and the role that professional bodies perform for healthcare professionals. And then finally, it will take an evaluative look at the effectiveness of multidisciplinary healthcare teams. So historically, there are many contexts that have shaped the NHS and the role of the staff that work for them, and these continue to do this. The NHS is responsive to changing needs, and this is reflective in the most recent role expansions within the nursing profession. The Modernisation Agency in 2011 designed new ways of working, and they implemented major changes to nursing practices. And to understand the full impact of these changes, it's important to look at the humble roots of nursing, seeing it as a vocational pathway for women at a time where they were unable to be educated and to take on clinical roles. So these changes redesign the nursing role, extending the skills of nursing, matching roles against skills, and improve patient care, job satisfaction, reduced errors, and provided a more efficient health service. New roles and career pathways were created. The new roles were nurse prescribers, advanced practitioners, modern matrons, and specialist practitioners. They're clinical roles and highly experienced professionals who have developed understanding, skills, and knowledge, having responsibilities for their own caseload and patients, and taking a lead on their care and decision making for their treatment plans. This was new to nursing. So, a clinical nurse specialist is an advanced practice nurse, must be registered nurse, and then go on to do a master's degree and gain a certificate in specialism. It takes a long time to become a clinical nurse specialist, and in addition to their standard duties, they provide patient care, consultation services. They might work in hospitals, clinics, or community settings, and they could be, for example, a Macmillan nurse, diabetes nurse, or a neonatal nurse. In addition to this, they carry out research and also supervise other members of staff. Emergency care practitioners work as part of an emergency care team in A&E departments. They treat within agreed guidelines. They're responsible for examining, treating, discharging patients, ordering and interpreting radiographs, prescribing medications, and these responsibilities do move away from standard nursing roles and into more of a clinical field. How have these changes impacted on nursing? Well, they've created career pathways, opened up opportunities. They've moved allied nursing closer to academia and added in a research focus. They've broken down barriers around nursing being female dominated, and they've moved the practice of nursing into a more clinical field. They've also impacted on patient care. They've reduced waiting times from arrival to transfer to wards. They've reduced 70% of A&E attendance by being treated in minor injury clinics. They've created resources in the medical team. They've left the serious cases to be dealt with by medical members of the team. They've improved care. They're able to put patients first. Nursing is at the intersection of care, and can provide continuity. So they diagnose, devise treatment plans, and deliver on them. These new changes are very exciting. However, they bring a very large level of responsibility, and it brings the role of professional bodies into a much more needed. These bodies exist separate to the NHS, and that they are there to protect, promote and maintain health standards, initiate these standards by guiding, restraining and enforcing accountability and professional healthcare practice. The general duties maintain a current register of registered healthcare professionals. They produce standards for education training and codes of conduct for varying roles, and they investigate when standards are not met. Across all of these governing bodies, there are some standard codes of conduct, and these take on the form of 4 principles which were inspired by the Hippocratic Oath. Now, these 4 principles are deemed essential for moral reasoning, and they are autonomy, maleficence, beneficence, and justice. Now, these might seem simple, but within them there's a lot of contradiction and overlap. So, for example, if a nurse is trying to empower a patient to have autonomy and make their own choices, they might make choices that bring about harm to themselves. So it's up to the nurse to move within these and just help the patient to make the best decisions. There are many governing bodies across healthcare which might relate to be more appropriate to doctors or to things like working hours and pay scales for trade unions. For the purpose of this presentation, we're going to just expand upon the Nursing and Midwifery Council. So the MNC, they're there to guide nurses and to improve practice. They lay out standards of practice, they protect nurses and patients, and they ensure high standards of care. They have a set of behaviours which are putting patients first, work with knowledge and skill, boundaries of professional practice, accountability, teamwork, using evidence to base their practice, and always being responsible. In addition to these behaviours, nursing also uses the 6 C's, and they are used for student nurses to focus while delivering patient care. So those are care, compassion, competence, communication, courage, and commitment. The NMC have 25 sections to their standards of practice, and these are expanded in full on their website or in their manual. These are their first 10, and these are the ones that relate mostly to those behaviours mentioned, the 6 C's, and also to the NHS Constitution. So that there are 6 values that all staff that work for the NHS must follow, from porters all the way up to surgeons. And they must work together for patients. They must have respect and dignity, commitment to quality of care, improve lives, everyone counts, and compassion. So we're now going to look at multidisciplinary teams, which are simply a group of healthcare workers who are members of different disciplines who come together to devise care plans and treatment plans for patients. The NHS have produced a manual called Making It Happen, and that helps to define some standardised ways of working, because multidisciplinary teams are quite responsive and dynamic, and they've attempted to put together some standards of practice. I think multidisciplinary working exists across lots of industries and has existed for years within the NHS, but most recently they've looked at how can they define those methods so that they can people can be rolled out in all parts of the NHS, but also so that it can attract the resources that it is needed. So how does nursing fit in with this? Well, nurses work very collaboratively, intrinsic in what they do. They work with many different healthcare workers all the time. So their process of nursing is very well used within multidisciplinary care. So it's a systematic approach and has been adapted by many care professionals. So this is a circular, continuous model of dynamic interpersonal working. They have interrelated stages, so assessment, diagnosis, outcome, implementation and evaluation, and they work within this constantly. So they may start at any point and they may jump in and they may go back and forth. And actually multidisciplinary working is like this. So this cycle of care has been picked up and used as a model for good practice. The NHS have set out some core development elements to multidisciplinary working, and they have stated that the continuum, core principles and commissioning are the key principles of this. Outside of this, there are also some other factors that is fundamental to the success of delivery of integrated care, and they are care coordinator function. So there must be some kind of care coordinator as part of the team, and it's been noted that having a good care coordinator ensures better long-term outcomes for patients. There should be patient-centred care, good communication, team working, compassion, confidentiality, clear appropriate clinical pathways that are followed, and they must use multidisciplinary care conferences, which are really important for discussing care within the team, but also involving the patient and delivering information to families and carers. So other factors outside of what the NHS put forward is working in partnership with the patient. The patient is part of that team, and it is important to see them as a member. The relationship between patient and healthcare professional is really important, and it starts when they first meet and all the way through their care. Interpersonal skills of team members are really important, and it should be seen as part of individuals' professional development. So if someone is lacking in interpersonal skills, it's important for the whole team that is addressed, because it will be the downfall. Empathy and compassion for the patient is important, and always putting patient first. So advantages to working like this. It is very, very difficult to evaluate the effectiveness of multidisciplinary teams. The NHS have found it really difficult, but there are good case studies out there. So the advantages are treatment plans are devised by more than one professional, so taking the whole body, the whole illness. Continuity of care, clinical practice protocols become more embedded, continuous evaluation of best practice. They are a catalyst for better communication between professionals and develop better working outside of that individual caseload. Knowledge and expertise is shared. They're more efficient and effective for better use of resource. Partnership working across specialisms and increased ownership of errors, so mistakes are acted upon straight away and eradicated. They incorporate patients' voices and promote person-centred care continuously. Unfortunately, there are disadvantages as well. So shared goals cause compromise for the individual professional. And so this doesn't always affect the patient, but it does affect the advancement of healthcare. Insufficient time to develop good collaborative working. There is no time. Time isn't assigned to developing collaborative working, and without insufficient time, this multidisciplinary approach is weakened. Lack of leadership can impact on quality of care. Definition of boundaries impact on care and time management. It's very dependent on personalities, and the congruence within a team will be impacted on an individual personality, and that is a positive and a negative, and it is something that is difficult to manage. So in summary, the NHS by nature is responsive, and due to contextual pressures, so those political, financial pressures which are ongoing and ever changing, the NHS changes, and it has to, but it also does have a positive intention to listen and learn to its patients in its development. Recent changes around role expansion has catalysed positive change for nursing practice. It's empowered women in the NHS and improving effectiveness of delivery and reduced waiting times. Governing bodies exist outside to protect healthcare professionals and patients and drive research and innovation and best practice. Teamwork has been developed not only within the individual role, but as an actual delivery mechanism. So multidisciplinary care teams are using specialist care pathways. They're difficult to evaluate, they're difficult to do, but best practice is being drawn out and hopefully will increase resources to strengthen this approach. Thank you for listening.